So this morning, we are going to talk about marketing and sales in the individual market with Allstate. First of all, if you did work a Walmart store with Allstate this year, I want you to be thinking about adding some of your thoughts or comments about working the Walmart store a little bit later, where we're going to be talking about Walmart. But let me give you a reason why, if you didn't work a Walmart store for us, why you need to get started doing it now. So a little history. So back a couple of years ago, Allstate comes to me and they're like, hey, look, we got this big deal, this big opportunity, and we want North American to be the leading FMO working with brokers in this great new opportunity. So lo and behold, this last summer, we launched into the under 65 space working with Walmart stores. A little information about Walmart. Walmart is the largest employer in America. They are the largest retailer in America. They are a Fortune 10 company. They're a global powerhouse. Everybody knows who Walmart is. They have stores in all states, and the average American can get to a Walmart store within 20 minutes. So pretty much everybody in America can access a Walmart store. There are 5,000 Walmart stores around the country. And we were tasked with helping agents get into Walmart stores in all 5,000. And we didn't hit it, make no mistake. We got about 1,000 agents and stores. And we are already starting to think about how to get ready for this next season, where we want to double that number for the next upcoming season. If you didn't work a Walmart store, you absolutely should. It is a tremendous opportunity that you just don't get anywhere else. There is no cost to the agent at this time. That's another reason why you want to nab a store, because if you don't, eventually they're going to start charging a fee, and you're going to want to be in there before they start charging fees. On the Medicare side, they already charge a fee. I think it's $1,500 to each agent working a Medicare store. So huge opportunity to not have to pay a fee. We're going to be staffing stores starting in June, which sounds like a long time away, but it's already March. It's coming up in another couple months. And now is the time to start getting yourself ready for it. There is a commitment, and I won't go through all the details. It's not a Walmart pitch. It does require 20 hours a week and a minimum of 3 days in store. Those occur starting November the 1st, which is required, and goes all the way through the end of the selling season, under 65 selling season. Most of the agents that did well with Walmart stores started working their stores in the summer and continue to work them all the way until March 31st, which is ultimately the deadline where we have to take a break for tax season, and then we come back afterwards. So you're going to want to work a Walmart store. In order to do that, you do need to have your Allstate contracting done. And if you haven't done it yet, highly recommend that you get that taken care of. And then you're also going to need a couple of ACA carriers. This is required by Walmart. Yep, they require that you have at least 2 ACA carriers through us and at least your Allstate health contract with us. If you don't have that, make sure to get that. You can go to our website to get contracted. But if the ACA season is over and I'm still waiting to get into a Walmart store this summer, then the question becomes, what do I do now? So I thought we'd spend a little time talking about Allstate short-term medical. You guys see my screen? Yes? I assume you can. Okay. So I'm on the Allstate website, agent portal, and I pulled up the state of Texas. That's where I'm located, but obviously you can do this with whatever state you're talking about. First product that comes up is short-term medical. And the first thing I wanted you to notice is that the Allstate short-term medical uses the Aetna PPO network. So as a reminder, you cannot get the Aetna PPO network from Aetna. You can only get it through Allstate. Isn't that weird? That's right. In the individual market, whether you're talking about ACA or short-term medical or any kind of individual product, if you want to use the Aetna PPO network, the only way to get it is through Allstate. I know that throws people like, well, why can't I just get the Aetna network from Aetna? They don't offer it in the individual market. It's only offered in the group market. But with Allstate, their short-term medical comes built with the Aetna PPO network. So a couple things, I'm not going to go through all in detail about their short-term medical, but it really is my favorite. It's my go-to. A couple things to note about it is you can get really price competitive with this product. If you go all the way over to the left-hand side of your screen, you can really strip this thing down. And the reason I say this is because when you have people come to you and say, I want health insurance, and you have to say to them, hey, I'm sorry, the ACA window is closed and you have to wait until November. And then you might be wondering, well, what am I supposed to do between now and November? The answer is short-term medical. You can sell this thing year-round. You can get really, really price competitive if you look at the left-hand side of your screen. Let me make this a little bigger. The left-hand side of your screen, the Essentials product. You pick your deductible and co-insurance and max out of pocket. And pretty much everything applies to the deductible. But if all you're trying to do is get to the lowest price point and say, look, Mr. and Mrs. Jones, when the ACA open enrollment comes up, I could probably get you a $10 a month plan or a $20 $50 a month plan. But you don't get that now. The open enrollment is closed and there's no way to get you in. So let's do a short-term medical. We'll do a 12-month and then we'll drop it once we get to the open enrollment. Now you might say, well, why a 12-month? This is March 12th. Why would I do a 12-month? Because that's where the rates are. You're going to want to focus on 12 months because you can drop it anytime you want. If they're looking for short-term medical to be more of their health plan, my go-to is this enhanced product. I probably sell more of that than anything else. I'll explain in a minute why I don't sell a ton of the copay enhanced. It's just really expensive. But a good go-to for me is this $5,000 deductible 80/20. And it is really priced competitively. In addition, it is kind of how Allstate sort of focuses its pricing to make sure it's really competitive. But a good old $5,000 deductible, 80/20 coinsurance with a $5,000 max out of pocket, $1 million annual benefit, which is way more than anybody's going to be able to use. Most things apply to deductible, and it's a really nice health plan for when something bad happens. Again, great opportunity to bridge somebody between now and the next open enrollment. So why don't I sell a ton of the copay enhanced? Well, clearly it's the best product. It's got the lowest max out of pocket. It's got a $5 million benefit. It's got copays for primary care physicians. Lots and lots of benefits. It's just pricey. It's just expensive. So if somebody is looking for a Cadillac, needless to say that copay enhanced is a Cadillac, but not everybody can afford it. All right. So that's short-term medical. I didn't want to spend a ton of time on it, but I do want to make sure that when we're helping our clients get between here and the next open enrollment, that we talk about the other products that they can stack on top of it. You need to be offering all of these. So let's kind of go through some of the ones that I like. Oh, and by the way, here's the most important reason why you want to stack them onto a short-term medical. The reason is because when they eventually drop the short-term medical and go on to an ACA, you're going to want them to keep all of the ancillary products. And that's how you have to sell. Look, Mrs. Jones, we may put you on a Blue Cross ACA plan in the fall, but we're going to keep all these other benefits because they're all going to be valuable to you. So the first one that I want to spend a little time on, my favorite dental plan is the Select Dental PPO product. So let's just quickly go through that. We're not going to, this again, not product training. Just want to make sure that we're talking about these products. So I like this product a lot because I think pound for pound, dollar for dollar, this is the best dental product out there. So I like that copay plan too. Very reasonably priced, $50 a month. And it is a Cadillac. Your preventive is all covered at 100%. Basic, it has a $100 deductible. Goes down to 50. Excuse me, not deductible, copay. Excuse me, I used the wrong term. This is all a copay-driven plan. So here, let me make this a little bigger. So $100 copay for basic services, it drops to 50 in the second year. For major services, 125 down to 75 in the second year, and then even major stuff, a $500 copay down to 350. No waiting periods. One of the things I love about this product is there's no waiting periods and there's no maximums. You're just not going to find a whole lot of dental products that pound for pound you can do better than that. And the prices are really, really reasonable. In fact, I should mention to you, this is the product I bought for myself. Great coverage. The only real thing that it doesn't cover, but most don't, is implants. But save of implants, this really pound for pound is best, to me, the best dental product in the market. Simple with just copays, reasonably priced, no waiting periods, no maximums, no pre-existing condition limitations. It is strong. Okay. I'm not going to go through all these. Again, this is not a product training. I didn't want to spend a whole ton of time on it. But again, if you're selling short-term medical to try to help your clients get to the next ACA open enrollment, don't forget to stack the ancillary now. And that way, if they ultimately drop the short-term medical to go on to an ACA or even a group plan, they can keep this stuff. That is a great dental product. I also like the hospital expense product. Great product to stack on short-term medical, or again, ultimately an ACA. Again, we're not going to go through the whole product, but it offers really great benefits that work terrific to help cover some of the out-of-pocket costs on a traditional medical. So you can do that product. There's also tons of accident products that I don't know why they have so many. Probably cut those back. Some notes. The other one, though, that I wanted to spend a minute on is life insurance. And you might be wondering, what the heck are we doing? By the way, there's cancer on here, there's critical illness, blah, blah, blah. But I want to give you a sales idea that focuses on life insurance. And you may be wondering, what the heck? I thought we were just talking about Allstate. Why are we talking about life insurance? Well, the reason is because in Allstate's portfolio is a term product, term life, that is a 5-year level term. Yep. 5-year level term. So it's a really simple product. It's 5-year level. You can stack it onto a short-term medical, or frankly, anything. It issues ages 18 to 64. If they can get the short-term medical, they can get the life insurance. As you can see, benefits are from 20,000 to 100,000. So you're probably wondering, why in the world would we be talking about stacking a 5-year level term for $20,000? Doesn't that seem ridiculous? But I will tell you, after 30 years of doing this, this is one of the best kept secrets in the industry. Stack this 5-year level term on every single Allstate sale. And here's what you're going to do. So you're going to be talking to your client. Okay, Mrs. Jones, we have put your medical plan together. And along with that comes $20,000 of 5-year level term. 20,000. So one of two things is going to happen. Either the client is going to say, is $20,000 enough? And that's what you're looking for. No, Mrs. Jones, 20,000 is not enough. Let's do this. Let me take this off. And let's get your health plan set up. And then let's schedule a follow-up. And let's just talk about what your life insurance needs are. You just upsold a life case without even having to try. So that's the very common reaction if you're stacking 20,000, a 5-year level term, 20,000, people think it's inadequate. And it is. But it created a situation where they had to say something like, that doesn't seem like very much. That's what you're looking for. That's the cue. Great. As soon as they say that, perfect. You're right, Mrs. Jones. We're going to take this off. We're going to get your health plan set up, and then we're going to have a follow-up discussion to talk about life insurance. The other option is they don't say anything. They're like, okay, that's what it has, and that's what it has. Pretty cheap. So you might say, well, have I done them any good? Well, you have, because if they didn't have any life insurance, you just add it, even if it's only 20,000. It's better than them having nothing. The second thing is you're really helping your commissions, because the commissions on a 5-year level term are really good. The premiums aren't that big, but anything you can do to give yourself a little additional commission is always a great idea. But really, that's not really the best reason to do this. The best reason to do it is hoping that the customer questions whether or not this is enough. And when they question it, you absolutely agree with them and say, yes, Mrs. Jones, you're exactly right. This isn't enough. I'm going to immediately take this off your quote. And we're going to have a discussion about 100,000 or 500,000 in life insurance. Some of our top life insurance producers use this approach. They win, the agent wins either way. Either the customer doesn't bat an eye and says, okay, and you just added life insurance sale to your stack. Or better still, they question it, you take it off of here, and now you've given yourself an excuse to sell life insurance to them, a real life insurance policy. Okay, that's my tip or trick for the day. Okay. If you aren't yet contracted with Allstate, I'm assuming everybody here is, but if you're not, let me make sure you know where to go. If you have any questions, please add them to the question box. You guys are awfully quiet. If you haven't done a Walmart store, I can't emphasize enough that you need to do it. If you're a full-time agent, you need to have a Walmart store. If you're a part-time agent, you need a Walmart store. If you're a side hustle agent, you need a Walmart store. It is the #1 best, easiest, least expensive way that I can guarantee you're going to get prospects. Guaranteed. Very cost effective. Just gotta put time in. Get a Walmart store. Again, first thing you got to do is get contracted. If you want a Walmart store, let me know. The second thing, though, is every prospect that you're talking to, you are making a huge mistake if you're turning them away, saying, nope, you can't enroll in ACA. Set them up on a short-term medical, bridge them from here to there. Don't forget to stack the ancillary, because that's where you're going to get products that stick for a long period of time, like dental. And then don't forget my little term life insurance trick. You can sell a ton of life insurance by just stacking it on to your short-term medical and then encouraging the client to ask you to take it off so you can sell real life insurance. Okay? All right. Any questions, comments, thoughts? You guys are awfully quiet today. Okay. So Emma is asking about, can you go into the stores after March 31st? No. So we are out of the stores on March 31st, and we go back in the early summer. The reason is because of tax season. Walmart had tax guys in there. So we're out on March 31st, and we're already getting restarted for the next season, but that happens in June. So you're going to want to get started with the process now. If you're not contracted, definitely get contracted. You need Allstate and 2 ACA carriers. If you need a list of stores that might be available in your area, please make sure to let me know, and we're happy to let you know the available stores. We can't lock them down quite yet, but we will be able to soon do that. And now is the time to get ready. Don't wait until the last minute. The store you want will be gone. Any other questions? Okay. Very good, guys. Hope you found that helpful and informative. Stay tuned next week. We'll continue in the process. Hope you have a great rest of your day. Let me know if you have any questions. Thanks, guys.